Good evening, everyone. I am Dr. Devashish Saini, and with me is Dr. Shaumik Kalita. We are founders of Ross Clinics and FamPhy, respectively. And we invite you to apply for our program for family physicians, which is called Family Physician Acceleration Program. In this program, we will accelerate the growth of your family practice and help you develop a strong career based around family medicine. What we have seen is, we've talked to a lot of doctors. We feel that it's not very difficult to open your own family practice. But a lot of doctors say that they feel the lack of guidance and mentorship while building their own family practices, or even thinking about setting up your own family practice. On the other side, Dr. Shaumik and I have successful practices, but we are not satisfied with it. We want to transform India's primary healthcare scenario and, as a result, the health system as a whole. And we want to do that by building this network of strong family physician-run clinics all throughout India. And we can't do it alone. So here we are, we have a lot of expertise, and we want to help doctors, and at the same time, doctors are saying that they need help, and therefore we have started this program called the Family Physician Acceleration Program. In itself, it's a 2-year program. In the first year, you will follow with us, you'll shadow us, you'll get a lot of one-on-one mentorship about family practice itself, and while you're working and earning a stipend, in the second year, by the beginning of the second year, we will set up your own family practice clinic. And there onwards, we will continue to help you grow that family practice. During this program, there are going to be three components of, one is the clinical competence, and medical knowledge is expanding so fast that the role of family physician is also expanding, and we have to keep abreast of the latest knowledge. And we will encourage you and show you how to utilize evidence-based medicine and the latest research in taking the best possible care of our patients. The second aspect is the communication skills, and in today's day and age, we need excellent communication skills to be able to win the hearts and souls and the trust of our family physicians, of the families that we take care of. And we have learned ourselves from a lot of sources how we can do that, and we'll be very glad to show you and train you how to do that. The third and probably the most unique aspect of this program is value-based entrepreneurship. We treat our family practices as businesses, and at the same time we never compromise on our ethics. And we have gained this experience in the last 8-10 years of how to build ethical businesses. And that's what we want to share with everyone who comes to us and asks us how to build a family practice. So that's in a nutshell the major components of our program. Now I'll ask Dr. Shaumik to talk more about, on a personal basis, how he feels about the program.
Hello, my name is Dr. Shaumik Kalita. I am the founder of FamPhy, the physician on call. Like Dr. Devashish talked to you about the structure of the program that we're talking about, I would like to take you through the reasons why this program is going to be really very important for people who would want to pursue this. 20 years back, when I started my practice as a doctor, if there would have been someone to mentor me and tell me that, being a family physician has a big role in India, I would have stuck to it, instead of moving from one space to another space. That's what most of our doctors do. One of the peer pressures that we have as doctors is, should we be a specialist or a subspecialist in an environment which is full of specialists and subspecialists? Is there a space for a family physician in India? I'll tell you, in our experience and our live experience and our businesses, we have seen that there's a huge space for a family physician in India. There's a big need space, and therefore, there's a gap which needs to be filled by the right kind of people to practice as a family physician. This program is going to allay the fears of a doctor, that he needs to pursue multiple specializations or subspecializations after being a doctor. It's going to allay the fears brought out because of the peer pressures or any other reason that may have. It's going to take you through the practical aspects of family medicine, not not about the theoretical concepts that you already know about. Clinical skills, etc. Keep on, clinical skills or diagnostic methodology keep on changing on year. But nuances of being a family, the basics of being a good family doctor does not change. Hasn't changed for years and years. Which requires confidence, requires ethics, it requires a little bit of business acumen and entrepreneurship. This is where we lack as doctors. We never are taught about entrepreneurship in the field of family physician medicine. This program is the right fit for people who want practical knowledge. And if I would have been paid, for doing this program 20 years back, I would have, things would have been totally different. So I think this is a program. If you really want to start up your practice, you want to be the doctor, the real doctor in the sense of the term, I think this is the program that you need to be joining. Welcome. If you have any questions that you need to ask us, or if you want to know more about the program, visit our websites, which is rosclinics.com or famphy.com, which is and then you can ask us any question that you require. Thanks.